This is Michael Smith of MedPage Today. I'm here in Washington at the joint meeting ICAAC-IDSA. I'm speaking with Dr. Herbert DuPont of the University of Texas Health Science Center in Houston. Dr. DuPont is presenting data on a new medication for an old traveler's problem, Montezuma's revenge. Dr. DuPont, this medication is what?
It's a new fluoroquinolone, like ciprofloxacin, and it is not available in the United States yet. These are the first studies to establish a license with the FDA with the compound. It is available in some European and Asian countries. But traveler's diarrhea, which affects probably 40 million people every year, is primarily caused by bacterial agents, bacterial pathogens, and antibiotics are the principal way we treat the disease. Fluoroquinolone was given to about 200 subjects with traveler's diarrhea acquired in Mexico or Peru, and about 100 were given a placebo in a double-blind random study that we performed and just completed. The antibiotic fluoroquinolone produced no side effects in excess of what we saw with the placebo, and it shortened the diarrhea dramatically. The duration of diarrhea once therapy was begun was about 20 to 24 hours in the Pruli cases. In the placebo-treated cases, they were sick for more than half of them, sick as long as we had them in the trial, 5 days, 120 hours, and we had to give them rescue medicine. So a dramatic difference between this new antibiotic and placebo treatment.
This study was in fact a treatment study. If there are no side effects, would you not consider it as prophylaxis? Could that work, or is that ruled out in some way?
No, prophylaxis is a real possibility. It could be used. It would work. It would be very effective. Mm-hmm. And if it could be taken in low dose and no side effects, it could be very interesting.
The clinical implications may be a little more complicated. You were working in a situation where people were able to come to you almost immediately after the onset of symptoms, but ordinarily if someone's on vacation, for instance, they're going to be 3 days into their vacation and have 3 or 4 more before they can get to a doctor. How would this be used in the real world?
Well, we think that traveler's diarrhea is an indication for self-treatment. And we recommend every individual going to a high-risk country of Latin America, Africa, or Southern Asia that they take an antibiotic with them in their suitcase. In case they get diarrhea, they treat themselves empirically.
I see. So, in other words, people do this already with other antibiotics. Your view is that this one seems to do a super job and would add to the armamentarium.
That's exactly, you summarized it very nicely.
Thank you very much for your time, Dr. DuPont.
Good.
I'm Michael Smith, MedPage Today.